Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today our topic of discussion is about a rare eye disease, that is Susac Syndrome. When we talk about Susac Syndrome, it is an autoimmune disease. And in autoimmune disease, we know that the antibodies are produced against the body. This disease, a rare disease, basically affects brain, inner ear, and eyes. So when these three organs are involved, we think about such rare disease, that is Susac Syndrome. So when we talk about the eyes or brain or ear, in fact, the small blood vessels are affected. That the inner lining of the blood vessels, it has been documented that there are antibodies which are produced and which are not pathognomic, but they have been recorded in these patients who are suffering from Susac, and mostly these are female patients. So let's have a look at this photograph. What happens in the eye, that these small vessels, when they are occluded, for example in this patient we can see in the photograph that the retina, the inferior retinal artery is occluded, and once that blood vessel is occluded, that area of the retina undergoes ischemic changes. So this is in this photograph we can see that there is a blockage and retinal artery occlusion and ischemic changes going on infratemporal side of the retina. Another photographs of the same patient in which we have done fundus photographs, and we have also done the fundus fluorescein angiography. After injecting the dye, we have gone and taken the photographs to see where exactly is the blockage. Here we can see that the fundus fluorescein angiography is corresponding with the fundus photograph. Here in the blood vessels, we can see that the veins are not occluded. The dye, the fluorescent dye which we injected, is filling up the retinal veins. But when we talk about the retinal arteries, infratemporal side, inferiorly, we see that it is not filling and it is giving us the black shadow over there. And it shows us that there is a micro level occlusion and blockage over there in the eyes. So when this happens over there, these patients develop sectoral, in that specific area of the eye, vision loss. So this is one feature of the patient suffering from the Susac Syndrome. These are the fundus photographs of the same patient from the different angles, and here we can see the whitening over there in inferior part. And this whitening is encroaching to certain extent the central area of the macula. Macula is the area which has got the 90% of the vision over there. So this blockage of the artery is inferiorly, but to some extent it is coming in the central zone. So these patients will develop decreased vision or vision loss in one side of the eye, not totally, because the macula is still, the central location is still preserved to great extent. In this OCT, we can see the OCT looks normal, all the layers of the retina looks okay. But usually in this disease, the inner layers of the retina undergo atrophic changes as compared to the outer layers. So most likely these changes on inner layers because of the vasculopathy changes. Photographs of fundus fluorescein angiography, same patient but later on. These patients develop recurrent episodes of retinal artery occlusions. So as I mentioned earlier, infratemporal was involved. Now that is the superior one. You can see fundus fluorescein angiography is done and it is filling up all the retina except upper portion, the superior portion. Here we can see that the dye is not going and the blood vessels are giving us black appearance, while the other all blood vessels are hyperfluorescent. So there is blockage, this time superiorly. Another view of this patient, superior, as I mentioned, there is no blood going in the retina and It gives us a dark appearance over there, black appearance. We call it hypofluorescent area in our language. And if we see temporally, even temporally, the one side over, you will see also hypofluorescence, because that area is also involved. So small blood vessels of the retina are involved in this patient, and you can see that this is a feature of recurrent happening of the Susac syndrome. As I mentioned in the beginning, that this disease affects 3 organs in the body: brain, eyes, and inner ear. And all these places, it is affecting the blood vessels, the inner layer of the blood vessels. Then we find over there anti-endothelial cell antibodies, which are not pathognomic, but they have been documented. So up till now, we have talked about the eye, the retina, where repeated blockages are happening. But in these patients, when the inner ear is involved, those blood vessels which are supplying over their blood, they also get occluded, and these patients have got hearing loss. So these patients will present to you usually in the clinic with a hearing aid. There are usually 2 types. One is the neurological, which is the severe form, in which brain symptoms are much more pronounced, and the other is in which the eye symptoms, which is milder form, are more pronounced. So whenever the brain is involved, usually it affects the white matter, and the small vessels, when they are occluded, the patients can give you a history of, it causes encephalopathy. I mean, the patient can have seizures, and he can have memory loss. He can present with us to the headache complaints, and also these patients have got symptoms of dizziness, vertigo. So all these things are happening because it is infecting the brain also. So 3 parts are involved in this rare disease. As I mentioned, it is a team approach. When multiple organs are involved, it is a team approach to manage this disease. We have to do MRI of these patients. We have to do audiograms of the patients. We have to do blood works of the patient, and as I mentioned, fundus fluorescein angiography, fundus photographs, OCT maculas, OCT angiographies. All these tests are needed to be done to act as a team to manage this disease. In active stages, of course, we have to use, it is an autoimmune, antibodies are over there, so we have to use steroids, high dose IV steroids, or later on which can be changed with oral steroids and gradual tapering. The other option for us is also to introduce the mycophenolate mofetil to control this autoimmune disease, and also depending upon the situation, we can also use infliximab. So in order to manage this, all these things in coordination and cooperation with all medical subspecialties, particularly neurology and ENT, they all have to work together to control this disease. So this was the topic of discussion today. The Sussac syndrome, a rare disease affecting females, and we discussed how it should be investigated and their signs and symptoms and management. As a team approach, especially close coordination is required between neurologists and eye doctors. And I hope my today's presentation will be beneficial to my respected audience, particularly to the ophthalmologists in their learning, in their clinical practice. I want to thank you for your attention and attendance. Thank you.